everybody. Welcome to the last week in our series on how to support the body through autoimmune disorders. My name is Eliza Bacote, and I'm a nurse practitioner and a certified wellness practitioner, and I'm also one of the leaders in this group that we all have come to love because it's such a great place for us to learn.
And I'm a nurse practitioner and a certified wellness practitioner.
Sorry about the double noise there. I had to have my phone on so I could see your comments. And so we love this group so much because we gain so much knowledge from it. I learn from you guys. You learn from us, the leaders in the group. And this has been a really intense month, I'm sure, for you guys and for me. It's kind of interesting as I have gone back through some of these disorders and diseases and really researched just some of the protocols and research some of the solutions. Hi, Betty. Hi, Debbie. Hi, Kristen. How are you guys? Even I was kind of reminded of just how much that people suffer that have an autoimmune disorder and how much support they need. So while it's been a very intense month for me, going through some of this material and putting it together for you, I'm so glad that we did. It's always going to be there for you in our group to go back and review. And these things are really important. And we use these things in conjunction with modern medicine. So these are wonderful support tools for people. This week was especially interesting as I started preparing the material because I have a couple people close to me that have suffered from a couple of these disorders. And the neuroautoimmune disorders and neurological autoimmune disorders are particularly debilitating, because they really start to affect our movement. And that can just be really tough. So these are the top three. These are not all of the autoimmune neurological disorders that we see. We see a lot of other more strange ones, less common ones. What I wanted to do is hit the ones that are more common. So tonight we're going to cover just some basics on myasthenia. We call it just myasthenia in the hospital. It's easier. Gravis, that actually is termed, it's a Latin term. Gravis actually means grave. Guillain-Barré syndrome, multiple sclerosis. And while I do want to point out the differences to you, because if you have someone that you know that's suffering from this, I think it's great to educate yourself on the differences in what they suffer from. Or if you're suffering yourself, then you probably know a lot about your particular disorder, but I just want to distinguish them. But I do want to say they're very similar in how they attack the body. So you're going to see, once we get to the protocol part, how we support the body with some natural tools is pretty similar. So we're going to start first with myasthenia. Unfortunately, I saw a lot of patients with this disease process in the ICU because it can at some point affect the diaphragm and the respiratory muscles, so they end up on ventilators sometimes. It's not a common disease, so it affects 5 to 7 people per 100,000. Predominantly, it affects women. And it's actually originally, most of the cases are thought to be triggered by an overactive thymus gland. The thymus gland actually, it actually helps us the most when we're children in producing T lymphocytes, which actually are active in our immune system. And then it sort of changes over time and becomes sort of non-functional. But in these people, it's actually very overactive and activates the immune system. And you'll find this throughout the medical literature. The medical treatments do not focus on the root cause. I found an article that even blatantly, says that, so I'm not just saying that. But they do help the disease process. So typically the mainstay treatment is steroids to try and calm the inflammation in the body and calm the immune system. And the picture that you see here on the left, it can be a little bit confusing, but let's just look at it for a second and understand how this disease process works. So when we have nerves that connect to our muscles, which basically the transmission comes down through the nerve and initiates contraction of the muscles so we can actually move. It's kind of incredible that as we move throughout the day, we don't think about this happening over and over, but over and over these neurons are firing when we want to go somewhere and move somewhere. And our muscles are working. So that neuron or that nerve actually releases a neurotransmitter called acetylcholine, and it connects to these receptors in the muscles, and that actually, boom, helps make the muscle contract. Now, what happens in myasthenia is you actually get antibodies that are attacking the receptors. It's kind of cruel if you think about it. It's really blocking that action of acetylcholine. It's damaging the receptor. And it actually, of course, this kind of makes sense, right? Starts to lead to muscular weakness. So a lot of the symptoms that you'll see in myasthenia, one of the first symptoms typically is what we call ptosis of the eyes, the drooping of the eyelids. That's actually typically a presenting symptom. Sometimes it can affect the vision. The face and throat muscles can actually change because of the tongue, difficulty speaking and difficulty swallowing, problems chewing, changes the face, facial expressions. Actually, when people start to have this, actually are sometimes afraid they're having a stroke because sometimes the face is drooping and they have limited movement. Neck and limb muscles are affected, weakness in the arms, neck and fingers, and of course in the chest muscles. And in crisis, it can be really bad, and people can actually have difficulty breathing. And those muscles that help us breathe and move air in and out of our lungs are dysfunctional, and they end up on the ventilator. So in this disease process, this can be, where you see waxing and waning and improvements and things like that. But it is typically a more progressive disease. The next one we're going to talk about, Guillain-Barré, is not. But I do want to point that out because some of the people that suffer from this suffer for long periods of time. And you can see here, even though we're talking about the muscles and this is a neurological functional problem, the real problem, the real root cause is in the immune system. Something has overactivated the immune system. The immune system is dysfunctional and it begins attacking the body. So Guillain-Barré. Guillain-Barré is unique in that it's one of the neurological autoimmune disorders that people typically recover from. And it affects the nerves and in the brain and the spinal cord, and typically also in the peripheral nervous system. So we see Guillain-Barré actually more so in the peripheral nervous system. So you see there what a normal nerve looks like on top. The normal nerve is actually surrounded by something called a myelin sheath. And that myelin sheath is actually made up of fat. That's why fat is good for us. And that actually helps insulate the nerve. So think about it like wiring in your house. Without that insulation, the neuronal transmission breaks down, and it's very difficult for that neuronal transmission to take place, and it's very painful, right? So there you see the affected nerve, the damaged myelin, and the exposed nerve fiber. Now, Guillain-Barré is very interesting. Many of you have probably heard of it. It's typically triggered by an immune response from a viral illness, or can also be triggered from a vaccine or medications as well. So unfortunately, we've seen that happen in the flu shot or any sort of vaccine. You'll actually see in the questionnaire, it'll ask you if you've ever suffered from Guillain-Barré because it's not recommended that those people receive vaccinations in the future because it's some sort of auto-initiation of the immune system. The immune system over-responds and, for lack of a better term, gets confused and starts to attack the body. Now, the great thing about this disorder is that people typically recover from it, but it's typically over years. When I would see these patients initially, they would be in the ICU in an acute crisis, on a ventilator, on tube feeding, with bowel management systems. They cannot control any of the functions of their body. But typically what you see in some of these people is that over the course of a year to 3 years, the myelin sheath will repair itself and will regrow, and they will actually regain function. You probably have about 10 to 20% of people that will have lifelong debilitating effects from it. But typically these people have to learn to walk again. They have to learn to feed themselves again. It's a devastating autoimmune situation. And so you can see here in this graphic, just describes a little bit more about it. So in the other two disorders we're going to talk about that we talked about, myasthenia and multiple sclerosis, they tend to come on very slowly and they progressively get worse. Guillain-Barré is very different because it happens typically rapid. So this is a more rapid thing that happens. People end up in the ICU. It's just very quick onset, and it's typically after some sort of illness that occurs, typically upper respiratory or, like I said, a vaccine. It affects about 3 per 100,000 people. So again, not a common disorder, but something that happens. And it's the most common cause of what we call acute flaccid paralysis in the US. Interestingly enough, US military personnel are at increased risk. This makes you wonder about, I always wonder and worry about the military and what they're exposed to as far as toxins and chemicals in their work environments, especially when they're deployed, and the things that they're breathing in. So that's an interesting thing that we see. This actually affects males more than females. And of course, women at high risk actually immediately after delivery. A lot of women, may not realize this, but you're actually in an immunosuppressed state when you are pregnant. And that's to prevent rejection of the fetus. And so we see this happen sometimes. I've had a couple patients that were immediately postpartum and started to have weakness and flaccid paralysis within 48 hours of giving birth. And typically the respiratory muscles are affected, so they end up on a ventilator. And the treatment typically, we do put them on high-dose steroids, but typically we give them immunotherapy, IVIG, something called plasmapheresis. That's where we actually exchange their plasma out through a big machine. And so we're actually trying to remove some of those antibodies that are attacking the body and replace it with normal plasma that does not have antibodies in it that are attacking the immune system. So multiple sclerosis, I would have to say, in my opinion, this is one of the more progressive, devastating disease processes. The only relief I think that people get from multiple sclerosis is it waxes and wanes. So the difference between this and Guillain-Barré really affects the peripheral nerves and the peripheral nervous system, even though it originates in the central nervous system. But multiple sclerosis is typically confined to the central nervous system. So you can do a brain MRI and you can start to see destruction. It's the same thing, destruction of the myelin sheath, and you'll see it in the white matter of the brain. And you can see lesions in the brain on MRI and lesions in the spinal cord. So of course, if we don't have neuronal or nerve transmission through the central nervous system to the rest of our body, then the signal stops there, right? And so this is a progressive disease. People typically get worse and worse and worse and worse as they progress through their life. But it can wax and wane. So typically people are responsive to steroids in this disease process, which calms the inflammation, calms the nervous system attacking itself. They experience, unfortunately, numbness, tingling, pain, and just very, very difficult time moving in these cases. So risk factors, women are much more likely to get multiple sclerosis than men. We know there is a genetic correlation here. So 15% have one or more members, family members or relatives who have had MS. So something about the body. And remember this, we now are learning about epigenetics. We know that based on the environment you put your body in, your genes can turn on and off. So while we share genes with our family, right, that makes us very similar. And so we see that correlation, but I always remind people you're not confined to your genetic makeup, because we are now finding out that based on different types of exposures to different things, certain genes turn on and off. But we know that there's a genetic component here. So common symptoms, fatigue, cognitive changes, because we have those changes within the brain, right? So that's a little bit of a different situation too than the Guillain-Barré. Guillain-Barré, people are typically completely with it, and it's very, very, very frustrating for them to be in that situation. But here you see cognitive changes, people get confused, depression, dizziness and vertigo, blurred vision, numbness, lots of pain in these disorders. Our body and our system, even our gut, of course, is controlled neurologically. So you'll see some constipation and changes in the gut, incontinence where people urinate on themselves. Of course, it affects their sex lives, right? Difficulty walking and weakness. Very, very difficult disease processes. So now that we've kind of described those, let's just talk about the supportive protocol. And a lot of this has been things that I have researched over the years, looking at alternative therapies. And again, you guys have heard me say this throughout the course. This is not a this is not a replacement for what your doctor recommends, or what a loved one of you that's suffering from this, what their doctor is recommending. So there is in no way, shape, or form are we telling you they should go on this and go off their medications. These are supportive things to do to help support the body as it heals through the process. And it's vital that they stay on medication through this process, because these are lethal disorders. So steroids become a very important mainstay part of treatment. And especially in multiple sclerosis, there's a couple medications that are used that are very, very, very important. But the adjunctive things that we do that help support the body, and I'll explain to you why, are what we've included in this supportive protocol: natural things, herbs, and essential oils that can not only help heal the body from the root cause, and also calm the inflammation. We know a lot of these essential oils and herbs that we use help calm inflammation pathways. That's well documented. That is well studied. There's no refuting that. And then also help support some of the symptoms that people live with, because these disorders are so debilitating. So first off is our sort of mainstay foundation of health, right? And that's our Lifelong Vitality Pack, which has the multivitamin, the omegas, as well as essential oils in there, and the Alpha CRS, which is our cellular repair. And the reason why the Alpha CRS and the Lifelong Vitality Pack is so fundamentally important is because it has ginseng, ginkgo biloba, and curcumin. So these are actually very, very important, because especially in one of the disease processes we talked about, I'll show you a graphic in a little bit, these herbs were actually shown to stop inflammation pathways in some of these patients. They're very inflamed because the immune system is turned on all the time. And so those are wonderful herbs, and it's so great that we have them in our Lifelong Vitality Pack. And these are very important along with the omegas. So think about when the myelin sheath is being destroyed, basically you want to have lots of fats and omega fatty acids to help repair that myelin sheath. So omega fatty acids become very, very important, especially for brain health. Of course, remember how we talked about in week 1 overview, the gut is extremely important. And so we want to support the gut through this process, even though some people say, well, that's not the root cause. Well, guess what? It may be, because a lot of the bacteria that we're finding in the gut that are at high levels or overactive are actually triggering some of these autoimmune disorders. And we find that correlation. So we recommend PB Assist 2 with each meal. That's a standard kind of gets you almost to 40 billion CFUs of probiotics a day. The reason I say consider Mito 2 Max, 2 of them daily, is because the Mito 2 Max has more of those green tea leaf. It actually has some more ginseng in it. It's got some other energy things within it that are wonderful for people that suffer from fatigue from these disorders. They get very, very tired, and their muscles feel tired. So a common complaint of them is, I need energy. I just feel so tired and lethargic all the time. So the Mito 2 Max can be life-changing for them. As an additional supplement. Consider Deep Blue Polyphenol Complex supplement. The reason I put that in here, so that's a strong anti-inflammatory herbal combination, right? So we have Boswellia serrata in there, lots of polyphenols from plants that are wonderful for pain. So for people that you know, or if it's you, that are suffering from pain due to an autoimmune disorder, I definitely add this into the supplement regimen because it helps some of those pain pathways and helps reduce inflammation as well. If people are having gut effects from this, or they have slow digestion from this, which can often happen because the muscles are affected and our gut is a muscle, Terrazyme can be very helpful. It's not a necessity, I would say, but 1 Terrazyme with every meal can be really helpful for those people if their gut is affected. I do recommend a veggie cap of 2 drops of cinnamon and turmeric essential oil daily. And the reason that is because we also have turmeric in the curcumin form in the Lifelong Vitality Pack, but the turmeric essential oil is a little bit different. We get the turmerones from that. And when those two combined work together, you have 7 times the availability to the body, meaning the body has 7 times more opportunity to use it. The body will use it, it's 7 times more. And so this is extremely important, and because turmeric is such a vital, root that we use for anti-inflammatory effects. It has anti-cancer effects. We know this, and not everybody's going to eat turmeric root every day. And so this is a great way to get it. And I think this is a vital component of a supportive protocol for anyone with a neurological autoimmune disorder. The cinnamon is very important. There's actually a couple studies on this related to neurological autoimmune disorders about how cinnamon breaks up the inflammatory pathways. This one especially because there's a couple chemical constituents in cinnamon that directly affected inflammatory pathways that were associated with neurological autoimmune disorders. DDR prime soft gels daily as directed, so 1 to 2. And the reason why we use those is because those are the oils. We're looking at lemongrass, frankincense, wild orange, that we have the savory oil in there. It's very, very important for cellular repair. And those oils help calm inflammation, help the cells repair, help the cells stay healthy. So that's an important component. Copaiba 2 soft gels daily. The reason why Copaiba actually is a great oil to use on people that have nerve pain topically. It works on the gut. It also works on the peripheral nervous system. We know it works on CB2 receptors directly. That's our cannabinoid receptors, right? The ones that everybody's so excited about for CBD oil. Well, guess what? CBD oil only works indirectly on CB2 receptors. Copaiba works directly on them. So this is so, so great for people with Guillain-Barré and myasthenia that are especially suffering from the peripheral nervous system effects. Serenity soft gels 2 nightly. The reason I recommend this is actually for the lavender. So there's quite a few studies about lavender in the nervous system and how it actually calms the nervous system. And it actually works on a receptor in our brain called a GABA receptor, which is an inhibitory receptor and helps kind of calm the body a little bit. So this is great to help us sleep, especially for people that are suffering with a lot of pain. But it's just an easy way to get that lavender in them daily because that can really help the nervous system. So that's the basic baseline supportive protocol. And I know that seems like a lot, but I'll be honest with you guys, this is one of the more severe disorders, and I think it's necessary. So if you have someone that's kind of starting out on a protocol like this, I would tell them to take it really slow. Certainly, you could just start with a Lifelong Vitality Pack and PB Assist, and then sort of add things in a very slow, couple weeks, by week basis, making sure also that the person's physician knows that they're using alternative therapies like this as well. The physician needs to know that. Excuse me. So let's just talk a little bit about supportive protocol for symptoms. I can't go through every symptom because that would be like an hour-long lecture if I go through every single symptom of what people suffer from, unfortunately, in a neurological autoimmune disorder, not including the emotional, depressive, effects from it. I would just say go back to some of our emotions education on that. So you can look at the symptoms that people are suffering from and go back to our essential oil group and search for that specific symptom, and you'll find a protocol that we've put out there for it. So I didn't want to go through every symptom, but I did want to go through some of the more important ones. Really topically, what's great for these people, a lot of people have tremors that have these disorders and a lot of weakness. You can find some incredible videos online of people actually rubbing Copaiba on their hands that have peripheral neuropathy and peripheral tremors, and watching the Copaiba after she puts it on, her hands calm down. It's pretty impressive. But when these symptoms happen for pain, following pain protocols, But any sort of muscle weakness, think lavender, copaiba, frankincense, and deep blue rub. Those are going to be your real topical relievers. And for pain, follow some of the pain protocols you've seen us post. And if it's really unrelieved by topical pain protocols that you've seen us do, really go back to that part of the protocol where I talked about adding deep blue polyphenol complex to the supplement regimen, because they really need those herbs. For fatigue, I actually recommend a lot of aromatic oils for energy. So wild orange is wonderful, elevation, peppermint, those are my 3 favorite just for energy, for uplifting. Can really help with that depressed mood that they deal with because of their debilitating disease. And of course, add that Mito 2 Max to their supplement regimen. And for specific body systems, you can follow the Modern Essentials body system recommendations. And again, just search in our group here, because I guarantee you, if there's a symptom out there associated with this, we have probably done a protocol or someone has asked a question, and you will find a solution for it in this group. I can promise you that. So you guys, that is our protocol. So that sort of wraps up like all the research we've done, what we know that helps as an adjunct measure to help people support them through this. I like this graphic. I put this up here. So I put this graphic up here. I really like it because this was actually, I found in a research article about modern therapies and alternative therapies to help support neurological autoimmune disorders. And I just thought this was really cool because it just covers the gamut. It may be a little bit small for you guys to see, but turn your phone sideways, take a screenshot of it. It's really cool. So it talks about different things that we use for inflammation: sage, turmeric, cinnamon, bees venom, you know, and that's to help the demyelination. Homeopathy, yoga, massage, tai chi, reflexology. They talk about marijuana and black seed, chiropractic care, for all these different problems that people have in the muscles, right? All the different ways that they can use alternative care. Inhibition, some studies on progression of disease. That's the ginkgo, ginseng, turmeric down there in the corner. Cinnamon, black seed, bees venom, saffron. And it's just, this is just a really holistic, beautiful picture, in my opinion, for all the things that people suffer from with these disease processes. I'll post it tomorrow in a graphic so you guys can see it a lot better. But I just thought that was a beautiful graphic of how I kind of wish I would have been taught to care for patients in the hospital. I was really just taught one way, the medical way, and we just don't think about these other things when we're recommending things for patients, and they really need this holistic care. So I thought that was really beautiful. And so that sort of ends our series on supporting the body through a neuroautoimmune disorder. And this actually wraps up our series on autoimmune disorders in general. So I hope I didn't overwhelm you guys. I know it was a lot of information, but now this information is here and you can come back to it and use it. Join us next month as we dive into the topic of pain and how to use oils and supplements to support the body through any sort of pain response. I know everybody out there suffers from pain at some point in their life, so this will be valuable for everyone to tune into. So you guys have a great Wednesday night. Thank you so much for joining in. Thanks everybody who joined in live. You're going to be entered for a free giveaway tonight. So thanks for doing that, and have a great night.